Hello, back again with another episode of Real Health Talk with Dr. Coring. For those who do not know me, my name is Dr. Coring. I am a board certified internal medicine physician as well as a hematology and oncology fellow who's training to become an hematologist and oncologist. And it is my absolute pleasure to educate common folks such as yourself regarding general health topics to keep you well. And a part of that, I like to do public service announcements as well. And today, I want to discuss a public service announcement that essentially I received on about a week ago. And I thought it was a good opportunity to let everybody else understand more about what I'm essentially about to discuss. And it's essentially a drug recall. In particular, this drug is called atovaquone, and this drug was recalled by a manufacturer who produced the generic, which is atovaquone, and essentially the manufacturers are recalling a batch or a lot that was produced between December 21st of last year and June 20th of this year. It seems like this batch it was produced in Clearwater, Florida, and distributed across the United States by wholesalers and retailers. And it seems like the reason why they or the government is recalling this medication and this batch is because it's contaminated. They found that the manufacturer have discovered a contamination of a bacteria called Coronella. And as of October 23rd of this year, the FDA has now issued a class 1 recall because of these findings. And what is a class 1 recall? It's the most strictest and the most significant recall that the government, the FDA, issues for particular substances. And this substance, this medication, essentially received a Class 1 recall on October 23rd of this year. And the Class 1 recall warns us, or patients, warns us as physicians who prescribe these medications, that the product could cause serious adverse health consequences and or death. And so that being said, because the consequences are grave, meaning it can cause death, then I think it's warranted a public service announcement. And so let's talk more about this medication, this product, and more about why would somebody or a patient need this product and or medication, and also warn or reemphasize the recall. All right, so the product again is called atovaquone. And the reason why this product is mainly utilized is essentially to prevent infection. And the main infection that this medication is really used now to prevent is something called pneumocystis jirovecii. And pneumocystis jirovecii is basically something called PCP or PCP pneumonia or PJP pneumonia. It's been called different things, but it's basically a pneumonia that's caused by a fungus. And typically people with healthy immune systems do not get this. This organism does not become invasive in someone's body to cause problems. And the only way, one of the main ways this organism can cause problems, i.e. pneumonia, is if you're immunocompromised, meaning if your immune system is weak. And so therefore, people who have weak immune systems should essentially be treated to prevent or have prophylaxis medications being administered to them to prevent this organism from manifesting as a pneumonia. And so people who have HIV, people who have AIDS, people who are on steroids long term, people who have weak immune systems essentially are giving medications to prevent this organism from causing problems, i.e. pneumonia. And one of the medications that are typically prescribed for this problem or potential problem is atovaquone. And it seems as though this medication is really good at preventing patients who have HIV, who have a weakened immune system, who have an organ transplant, who are taking steroids or other immunosuppressive agents. Um, Typically, atovaquone would be prescribed to prevent a pneumocystis jirovecii pneumonia. And so essentially that's the people who I would like to talk to today. It's people who fit the category, people who may have HIV, people who may have AIDS, people who may have organ transplantation, people who may have hematological cancers, people who may be taking corticosteroids or other immunosuppressive agents. This message is for you. If you are being prophylactically treated, against this pneumonia with atovaquone, especially if it's a oral solution, because it's the oral solution of the atovaquone that was recalled. If you're taking an oral suspension, basically a 750 milligram per 5 ml solution, it's these bottles that were specifically recalled, and it's the suspension that are causing problems, that are contaminated. All right, and this oral suspension essentially can cause infection, such as inflammation of the heart, and cause permanent heart issues if you were to have or take or ingest a contaminated product that's contaminated with a bacteria called, essentially this bacteria is called Coronella bacteria. And so this Coronella bacteria is contaminated or found to be inside these atovaquone oral suspension solutions. And so it's these suspension solutions that could potentially cause problems. And so therefore, if you've been prescribed this medication in an oral solution form, you should contact right away your pharmacist and or your prescriber to make sure that it's not this particular product or lot number that has been recalled. And I could give you the specific NDC, and this is the drug identification number that specifically are problematic. And so the NDC, you could tell your pharmacist, is going to be 69452-252-87. And it's specifically for the product or lot number 2310083 that expires on September 30th, 2025. And it is these bottles, over 2,000 bottles, or nearly 2,000 bottles of atovaquone with this NDC number, with this lot number, with this expiration date, with the strength, 750 milligram per 5 ml strength, and it's the 210 milliliter bottles. If it's this product that you have been prescribed and are taking, stop taking it, please, because it's contaminated with a bacteria that can essentially cause you to have heart inflammation, heart problems, all right? So it's very dangerous. It could be even lethal if you ingest this product. And the reason why you would be on likely this product is to prevent you from getting a pneumonia. And the reason why you're at risk for getting a pneumonia is probably because you have some type of immunocompromise. You have a condition that's compromising your immune system. Common conditions are HIV, AIDS, cancer, organ transplantation. And it's likely that you're taking steroids or medications that's causing your immune system to be compromised. And so therefore, it's typical that we treat you with agents such as this agent, atovaquone, to prevent you from getting what we call an opportunistic infection, such as PJP pneumonia. And that's why you may need the medication. But there are other medications that you can take to prevent this infection from happening that's not contaminated. So just to summarize, if you are having an immune compromised condition because of HIV, AIDS, organ transplantation, you're on chronic steroids for whatever reason, you have a cancer, and you need to take atovaquone or have been taking atovaquone, especially if it's the oral suspension, please consider talking to your pharmacist, talking to your physician to make sure that you don't or you're not taking a contaminated product of this medication. And if so, you need to be switched to another compatible agent to prevent you from acquiring the essentially the opportunistic infection that this atovaquone helps prevent. All right, so that's my time, guys. If you're taking atovaquone, especially if it's the oral suspension, please call your pharmacist and or your prescribing physician to get this medication switched after finding out that it's not a contaminated product. You may need to get it switched to another product. That's my time. Love you guys. Have a good day. Bye. Oh, like and subscribe. Please like and subscribe. Peace.